Just in terms of housekeeping, this meeting will be recorded, so by all means switch off your camera if you don't want to be on the recording. If you could also keep yourselves on mute, that helps as well, and that I need to be one that particularly remembers to do that because I've got builders next door. So just tell me if you hear banging and I've forgotten to put myself on mute. Other bits of housekeeping, I'm afraid all the other bits are down to you. Tea and coffee, toilets, fire exits, that's down to you. And everything, we've got a presentation and some other bits and pieces, links and things, and that will all be on the website by Friday. And I've actually just put in the chat at the beginning the link to the presentation today. So just so yeah, I hope you can see that okay. That's our that's today's presentation. So this is the program. We've got a few short items. We're going to talk about, or Ruth's going to talk about the UCL Evaluation Exchange Program. Hopefully Sadia will join us to talk about the Camden Renewal Commission. And I'm going to mention a Google partnership that we've got going. And then we're going to get into the main part of the agenda, and that's in two parts. The first is talking about the BAME fundraising project, and then I'm going to hand over to Diane to talk about the new Health Inequalities Network, which is a partnership with CDA and Health Watch, and I know both are on the call today with us. And we've got a little bit of a breakout just to discuss how that Health Inequalities Network goes. So without further ado, here is a slide about the evaluation exchange, and I have to apologize to Ruth. For some reason I couldn't get the UCL logo to appear on the slide, but Ruth is from UCL. So Ruth, can I hand over to you to just say a few words about this?
Yeah, thank you, Kevin. So I can tell you about the event we're running, which is part of the Evaluation Exchange Programme. So I'll tell you first about the session, and then I can very briefly tell you a bit about the Evaluation Exchange more broadly. We are holding a session on the 11th of March at 11 AM called Making Time for Evaluation and Learning, Top Tips When Resources Are Tight. And it's aimed at voluntary sector organisations looking for practical ways to build evaluation and learning into their work, and also recognising that organisations may be looking for ways to adapt evaluation approaches in the context of our work in the pandemic. We'll have a key speaker, Elizabeth Parker, who's the Principal for Evidence and Impact at NPC, and she'll be looking at practical ways and methods to evaluate in the current context. And there'll be an opportunity for people to share their experience and their learning and to learn from each other's approaches. You can sign up for free via Eventbrite, and I'll put a link just after I've spoken into the chat. And if you have any questions about it, then you can email me via that email address on the slide. And I can also mention that this is part of a broader programme. In October this year, there'll be an opportunity for 6 organisations in Camden to be more involved in the evaluation exchange programme. In the spring this year, we're going to be recruiting some PhD students from UCL who want to help an organisation tackle a particular evaluation problem that the organisation might have. And the students will then be matched with an organisation to work with them 1 day a month for 6 months to find a solution to that evaluation problem. Organisations will be able to apply from springtime this year, and we'll be working with Voluntary Action Camden to help raise awareness as well. And if you're interested in that broader programme, then we're hoping to hold an event at the end of April for people to learn more about those opportunities that will be happening in October. But in the meantime, if you have questions about evaluation more broadly, everyone is welcome to sign up to our event on the 11th of March.
Great, thanks, Ruth. I don't know if there are any questions about that. I mean, I think it's quite interesting. I guess the interesting takeaway for me is that although this is an interesting standalone event, there is a lot more coming, and so it's going to be one to keep an eye on and get involved with. Okay, let's move on to our next. And now we were hoping to have Sadia to tell us about the Camden Renewal Commission. I don't think Sadia has joined us. So
I am.
You are, beg your pardon. Okay, Sadia, tell us, how's it going and what's yeah.
I'm just gonna start introducing myself, and unless you did it for me, and then I'll start.
Go ahead, you say, Sadia.
Hi, my name is Sadia Farah, and I am a director of First Step Action Charity, and I'm also member of Renewal Commission in Camden. So nice to meet you all. I just wanted to start in terms of what are our missions and what are renewal. So far we achieved, and so far what the agenda and what it is that we normally do. I don't know whether you guys are aware of Professor Mariana Masrali, director. Do you know any of her work? Yeah, this is based on her, approach, which is, it is collaborative work between the community and the council and a higher level. What is this doing is putting all the community leaders, professors, it's not only community leaders, I think it's about business owners, community leaders, private sector, public sectors, a variety of different people. I think we're quite huge people that are members of the commissioners. What our mission is to put us together in a fast and just discuss what the main needs are for Camden, and how do we as a collective people and influential and people who can do different things, how do we input this commission and take it further. So what we done is different meetings. There was a lot of agreement, disagreement, and also different things that will collide. But what came out of it was the most important thing. It was way of working together and achieving a goal we all agree on. So within the discussion of, in those months going on, unfortunately, lockdown came and all of those different things. But however, it has not stopped us to meet in Zoom and discuss it a bit further. So without the further ado, what we came up with was the outcomes was collective missions that we agreed on to make sure that that is inputted in Camden Council. Georgia, who is very brilliant, and her team always there to take the notes and take the inputs on the different people. So the missions that came up, or that was one of the things that we were focusing was the youth and the safety of it, because you guys are aware of there's so many incidents of knife crimes and different things that were happening. So it wasn't only to to think about how do we solve it, but we were thinking about what is the cause, how is this come about, what can we do. So those was one of the things that we were came out of it. The mission is that all the youth will come into take in part. I think we were very successful that youth has been leading some of the youth organization in the borough, or leading I think it happened last month, is a youth forum where they all come together and discuss how they take it further to that mission within Camden Council, also leading that project. That was one of the things that came out of it. The second was the poverty and food, lack of food how do I say, poverty that came out of it. But the reason we wanted to develop that and look into it is because of the poverty. Where does that come from? Is it because of the employment? Is it because of different things? So we liaise with the the people, the organization, the grassroots organizations that actually contribute to those food projects, and how does we make sure that they access it, and how do we develop it a bit more? And so it's not only the food and the poverty line of it, it's about why is this in Camden in this century, and being one of the vibrant council organization, why is it we're facing in this poverty? And also the third one was equality and leadership, in terms of is there BME community leadership in higher decision making, and how do we get involved with all of those things, and how do we empower and making sure that how do we make the getting involved with that, and people who are leading different people who have got the qualification and the universities. And I think, and one of the things that I think UCL was very lead on was how do we employ people like that, and making sure that they are part of the community and in a higher level making decisions. That is another mission. And the other mission is an environmental housing issues, and how do we create a better Camden housing, and you, as you're aware of, there's a lot of crisis about housing and people housing, and also gardening, arts were coming into that, and how do we display different arts in the community, how do we get involved in art, how do we get gardening a bit better, all of the different things that involved safer environment, greener environment. So all of those missions come together and we have different people who deals with it, but we have, as a commissioners, we have a meeting that we discuss it. How do we take it further? What do we achieve, and how do we, you know, take a bit more to the point where we want it to go in 2020. One of the things that last meeting was good, and also making sure 2025, what does that look like in terms of Camden and what Renewal Commission has achieved in a sense of, like, let's say a headline or Camden Journal will write on it and envisioning what our input would be in the future prospect. So those are the things that can happen. If you've got any questions.
Yeah, thanks, Sadia. I mean, I think this is quite a big one, and maybe we should devote more time at a future forum to, because each of those 4 missions, each one is really big and ambitious. And I guess it would be, I think maybe we should bring this to a future forum as a bigger agenda, and get you to tell us a bit more about how the forum is, how the Renewal Commission is achieving these aims. And you mentioned fitting in with Camden 2025. That's interesting, and I guess looking at the milestones. What I've done is I've put up the website. There is a specific website for Camden Renewal Commission, so people can have a look at that. So thanks very much for that, Sadia. That was a really interesting update on what the Commission was up to.
Thank you. If you've got any questions, let me know. I can ask and I can answer. It's a lot of work we do. We spend 2 or 3 hours a time when we meet, so it's not a easy, you know, let's do this and leave it kind of thing. So if you have any questions, please do ask. Great.
Okay. Thanks, Sadia. And I think we should plan to do spend more time on this at a future forum as well, because I think there's a lot in there. Okay, and very briefly, I'm going to move on to our third update. And this is just to really announce a project that we've got going with Google. We're going to have a proper announcement soon. It's quite exciting. It's a 2-part project. It's about helping organizations pay for space. So when we get back, when things go back to, say, normal in inverted commas, we will be helping small groups with a bursary fund to be able to pay for space in buildings. And part of that is Google are also very keen to use their muscle and their know-how around tech and support and mentoring to help small groups as well. So this is you've probably seen this in the bulletin, and maybe it looked a little bit mysterious because it looks just like a survey, but it's actually a survey to gauge your interest in these Google tech things, but also to register your interest in this program. So my suggestion is do it anyway, because then you'll be on the list, and more details about this project will be released soon. And obviously the bursary can't start until we start getting back into buildings anyway. But yeah, there'll be more details on that. Great. Okay. Speaking of tech, I've got to get my tech to work. Okay, and there's in the details there is a link, and everything will be up on the website as well. But the link to this is in the chat, so you can get it now. So wow, without further ado, first of our 2 big launches today. This is our fundraising support project for small BAME organizations. And we've got 2 partners. This is funded by the council. So thanks very much to the council for providing that funding. And we've gone into partnership with 2 organizations that specifically support small BAME organizations, both doing it in a kind of networked way First is Always Network. Some of you may already know about them. And the other is Ubeli, and I'm sure many of you know about both of those actually. Now, on the and yeah, so Diane will be the contact, again, what we'd like you to do today is just register your interest in this, and then we will get out further details very shortly. Now, I believe we've got the, I think we've got, it's Carl. Carl, do you want to say a few words about Ubeli?
Unmute myself. Can you hear and see me?
We can certainly hear you.
Okay, good. Name is Carl Murray, and I'm with the Ubeli Initiative, and I also project lead the program we refer to as Mali Enterprising Leaders Program, which is MEL for short, and that's a national program that that's reaching out around capacity support development, largely picking up on the 9 regions of England as opposed to Scotland, Wales, and elsewhere. And so we've been working under the umbrella of funders like Charities Aid Foundation, National Lottery, City Bridge Trust, London Roots Programme, or it's the GLA funded programme, looking at infrastructure support. And this area of work fits under our capacity support development framework. And what we've got in mind is to deliver a series of workshops and webinars based around a self-assessment framework over coming weeks, months, I presume. Who knows when this period will come to an end, when we can actually be a lot clearer on how things are running. And so the aim and the intention is to sort of work with a number of organizations to first undertake a self-assessment in terms of your capacity, and then to use that assessment to help you to understand the funding arena, and to see if we can help you through a series of conversations and workshops on producing what I call impactful applications in particular. I hope that's helpful. We have a series of programs currently underway. Our new round of webinars and conferences start this afternoon on a wider platform. And so anybody who comes under this framework, who is being supported by us, will also have access to those webinars and seminars. So we'll just add your names and numbers so you won't get left off the invitation list. So that's another additional support. Today we're looking at governance and effective board governance arrangements. So I'm leading on that with another colleague. And we've got sessions coming up on e-commerce using digital platforms, and see how you could transform and translate your program, your services onto digital scenarios, soon as though that's likely to be the way we're going to go forward in years to come. We're also looking at things around systems thinking, looking at how you policy and influencing policy and decision makers, and just looking at a whole systems thinking arrangement. Other things we've looked at in relation to fundraising and the likes. Just before, when I come off on the chat, I'll post a link to where we've got previous webinars, so you can access those, so you could get a sense of what some of them cover. Some of them have video and some have slides and the like, so you can pick that up. So I'll post it on the chat after I finish. But yeah, it's just a quick snapshot of some of the stuff we're covering. And we're running a host of these webinars starting from today through to the end of March and possibly beyond. We will have a bespoke one for Camden for the groups that are in scope, but you also have access to the wider open one.
Great.
Okay, I hope that's helpful.
Yeah, thanks, Carl. That's really helpful. And you know, as Carl said, we'll get the details out. So Diane's the contact point. So register your interest with Diane. And the other partner is Always Network. I think we were hoping that Samir would be here, but it's a similar network. Some of you may be familiar with the network. It's more specifically aimed at small Muslim organizations. But the idea was that this will give people a choice, and they can read about the value, read about AWN, and decide which program. Programs are quite similar, and they work in a networked way, and then choose for themselves. And of course, what we're trying to do is also maybe have some other alternatives, so that it's rather than just the two choices. Maybe there are others as well. But the idea is what attracts us to both of those is the sort of the networking. So it's a strengthening organizations rather than just simply giving out fundraising support advice. Great, okie doke. I think without further ado, I'm going to hand over now to Diane for our second the biggest chunk of today's forum, which is a new Health Inequalities Network, which we've been developing with all sorts of partners, especially Health Watch and CDA, but also working with the Council and others. And Diane has been working very hard on this. So Diane, let me hand over to you.
Yeah, thank you, Kevin, for that. So I am very conscious of time, but basically, so just to give you a little, sorry, Kim, can we switch to that next slide? So obviously, we're talking about the health inequalities is really hot right now. The pandemic has just exacerbated all these different issues. They're affecting BAME communities and people from ethnic backgrounds, but also people with disabilities. And obviously, yeah, the recent figures are sort of shocking, but obviously not surprising. So what we wanted to do was we've got our connections with the NHS, public health, and as well as Kevin said, our VCS collaborators, Camden Disability Action and Camden Health Watch, will be coming together in partnership. And we're hoping that this network can develop and deliver initiatives that can kind of connect people from these disproportionately affected groups. You know, that COVID has kind of exacerbated all these huge problems, and as well the health providers, the policymakers, and enable, you know, the collaboration, the awareness raising, and all this sort of work. Now, what you can see here is our aims, and, you know, talking about providing groups and other marginalized communities with a platform to interface with health and care services, you know, enabling them to raise issues, seek solutions, support BAME focused organizations to develop their impact and help them to progress sustainable community health initiatives. Again, all of this stuff is stuff that VAC have been very good at doing in the past, and, you know, co-produce training, support peer groups, problem solve, instigate action, use our social prescribing, that's absolutely fantastic, and our health data to inform local community action and work. The data, people are always coming to us and asking us about data that's collected from the work that we're doing, and other providers to obviously generate evidence for action. And obviously the big part of our work is connecting people, connecting organizations, public agencies that make these decisions at a higher level, and people who are sort of making decisions about improving health, so that there's a shared understanding, a better understanding about how to make decisions for community health. So we want to do all that, as well as train, support our volunteers, enable our resident groups, our participation groups to have support the communities and have access to health services. So this was a very sort of general aims of our network. But what I would like from you, and I'm so sorry because it's just awful when you show up at a meeting and they give you work to do, but what we want to do is we want to put you in little groups, and if I could, I'm going to assign you to one of our VAC workers, and don't worry, you won't have to write things down. So our VAC guys are going to take some notes from you, and what I would like is just a little bit more of an understanding of fine-tuning those objectives, because you know what we don't want is another organization that's doing the same thing that the other 50 other organizations out there are doing. We want to be able to be responsive to what you guys need. So we want to talk about priorities. What do you think the priorities for this network should be going forward? Secondly, what do you want to get from us? What, you know, for your organizations, what is it that you want to get from us? And lastly, how do you want to engage? You know, I've had lots of queries over emails over the last couple of weeks of people saying to me, oh, I don't want to go to another meeting, and oh, the digital situation is an issue. So if there was something that you could send to us, you know, once a month. So type of information around communications and how best we can maximize you know, the network. And we do have a VAC web page. We're going to be putting all the information about the project support on there, UBALE and AWN, all of that stuff will go on. So watch this space. And obviously, if you're interested in any of those, just to register your interest, or if you have any queries about the program, again, you can email me. But what I'd like you to do is, Ricky, are you around? He's our IT whiz kid.
Hi.
Thanks, Ricky. I just wanted to put everybody in just a little groups, just a couple of minutes, guys. Like, it's, you know, it doesn't have to be that deep. Just jot down a few notes. And what I was going to do is, rather than us all coming back and feeding back, what we're going to do is the VAC guys, they're going to either put it in the notes or in the chat, or I'm going to compile everything and it's all going to be on the website. So when our newsletter comes out on Friday, you'll have all the notes from this meeting and we'll be able to collate all of that. So I shall see you guys in a couple of minutes, and I'll also put the questions in the chat as well. So thanks, guys. I really appreciate it.
Would you like groups of 4s or 5s?
We can do 4s, can't we? Or maybe 5 is better. Yeah, 5 is fine. That was fantastic. Thanks, guys. Wow, I was still chatting. Didn't even see the countdown. Thanks, Kevin, for that. Brilliant. I mean, I couldn't even write fast enough. How did other VAC guys, how did you guys get on?
Fine. We need at least half an
hour. I know, it's crazy. We were just getting going. Thank you so much, guys. I've written down tons of stuff. Sorry, who was that? I can't hear. Who was that? Was hand up?
It was your echo, I think.
Oh, it was. Oh gosh. All right. Sorry about that. Yeah. So what I think we're going to do is, because I'm conscious of time, we will collate all of that information that everybody's given, and I will again put it on the website, as well as all the information. We had some really big, fantastic discussions around funding, and Chikwaba gave a fantastic example of that. Like, if you think about the 30, 40 odd organizations that existed 10 years ago, there's like 6 of them left. And it's just this idea about, you know, sustainable, just existing. And I'm really hoping that this this partnership with UBALE and AWN, we can try and get some funding application support to all these organizations, and some really great suggestions about, you know, partnering. Sorry, is that Mary?
Yeah,
are you all right, Mary?
I was in mid-sentence. I was saying that I went to a class because I was sent by the doctor, and there were a lot of Black and minority ethnic people there that I never saw. Those kind of people at my local classes at the community centre. They wouldn't have been allowed out of doors probably to go to that. So the fact that they were sent by the GP probably gave them permission. So there should be some more partnership with the NHS to encourage that, you know, the fitness. That was, I never talked to anybody about it, but that was my guess.
Yeah, partnership with it. And this was for fitness class. Like
yeah,
fitness.
And they've got space. They've got space.
course they
You know,
do.
that's
They
probably
always
not
do.
being used. They've got huge areas in the doctor's surgery, just lots of empty seats because of the booking system that aren't being used. There's lots of scope.
Fantastic.
I think in
Thank
addition
you so much,
to
Mary.
that, in terms of African communities, they would more likely be able to listen to faith leaders, cultural leaders in the communities, because I think some of them don't really trust the NHS. So they need from the community who they trust to advise them on that.
Faith leaders, yeah, absolutely.
Good point. And
thank you so much, guys. All of this information, I was thinking as well, if there's things that you think of that you haven't had a chance to discuss in the groups, or even actually, I've just thought about that, that might be a really good idea. We had a conversation in our group, we were talking about the engagement, and we were talking about, you know, we need to find that right balance between time and commitment and, you know, everything not being online. And obviously, hopefully we're coming out of lockdown, really opportunities, people have been saying to me about opportunities to actually physically meet. If we can do that safely, then let's try and do that, you know, because we've all been away from each other for so long and we're all kind of zoomed out. But thank you so much for that. And like I said, if there's anything that you want to email me, we're going to put the email, aren't you, Kevin? Again, the interest in the network, we've got these organizations that are going to be supporting with applications, and we can try and get this support some support out to our organizations. And also to register your interest, again, just email me. And when our if you haven't registered for our newsletter, our bulletin that comes out on Friday, make sure you do that on the VAC website. And you can find us if you go on the VAC page under Get Involved. So if you go to the Get Involved tab, you'll scroll down, you'll see the Health Inequalities Network there, and all our information will be on there. So thank you so much for your time. I really appreciate it. Thanks, Kevin. Back to you.
Thanks, everyone. And sorry, the time just whizzes by, doesn't it? We could have spent more time in the groups, and I'm looking forward to reading the notes to hear what all the groups had to say. But as Diane says, time is running out. It would be nice just to hear, did anyone's group have one of those sort of eureka moments? Did anyone think there's something we've really missed here, or this is who we should join up with? Will I read that in the notes? Or
we had some really good discussions about how some organizations have basically managed to exist because their partnership, I know it's not, you know, like by moment, but partnering, linking up with organizations who are bigger. So those smaller organizations having joint applications with the bigger organizations. And I think we need to be a facilitator in that to try and help support that.
Yeah, that's an interesting one, isn't it? Absolutely. Okay, well, I'll do look forward to reading the notes of all the groups. And what we'll do is we will put all the information today up, including the participant list with the emails. So if you don't want your email to be circulated, do let me know so that we can redact it from the list. But that way, then you can by all means carry on your discussions. If there were things in your group or people you wanted to discuss with, then you can use that contact to get in touch with them and carry on the debate. And by all means, carry it on with us and with Diane. Diane is the contact for this work, and her details are in the information that we're circulating, and obviously on our website as well. So I guess it just remains for me to thank you all for coming today, and also thank you to our speakers, I guess in particular. Thanks to Ruth Vanstead-Joss, who talked about the UCL evaluation program. Thanks to Sadia Farah, who talked about the Camden Renewal Commission. She's from First Step Action. And thanks to Carl Murray, from Ubeli, who talked about the BAME fundraising support project, and we will at a future meeting, well, in fact, AWN Sunir talked in July, so some of you may recall her from that meeting, but we'll get them back again to give you updates on how that project is going. Yeah, thanks to Diane, who led our discussions today on the Health Inequalities Network, and that is, you know, I'm looking forward to that. And our partners are on the call today. We've got Healthwatch, we've got CDA, Shelley from Healthwatch, Colin from CDA. So we're really excited and looking forward to that partnership going forward. And finally, just leaves me to say that the next forum is on the 24th of March. Like this month, it's been pushed forward a week, so it's on the 4th Wednesday of the month, not the 3rd. So it's the 24th of March. And of course, we'll put out publicity and information about the topics. And if you've got ideas for the topic for that one or any future forum, then please do let us know. Otherwise, just remains for me to thank you all for coming and look forward to seeing you all soon. Thank you very much.
Kevin. Thanks, guys.